Good afternoon, and thank you for joining us for today's briefing of the St. Louis Metropolitan Pandemic Task Force. As usual, I'm joined by Dr. Clay Dunnigan from BJC Healthcare, and we're here to talk about what we can expect going forward, as well as a couple of recommendations. Now, we had not planned on doing a briefing today, but because of the rapidly deteriorating COVID situation in St. Louis, we felt it was really important to let the community know where we are and what they can do to help prevent the disaster from occurring. Now, as I mentioned, we're continuing to break records in cases and hospitalizations. Sadly, today we broke our single-day record for COVID admissions. Our task force hospitals are reporting 169 admissions yesterday due to COVID. Now, this is an astounding number that we fear is not going to retreat, and the majority of those admissions are the unvaccinated. Now, these admissions will be added to our already full hospitals, and what that means is that it decreases our ability to care for all of our other patients. Now, we expect the number of COVID patients we are taking care of to continue to climb, and this is really a frightening scenario. Now, we have staffing challenges because of those high numbers of patients, as well as a number of our staff who are testing positive. Now, because of this, our capacity could actually decrease. And that would mean we have less intensive care capacity when we really need it the most because our workforce is becoming depleted. Now, remember, our caregivers are vaccinated per the healthcare mandates. That doesn't mean that they won't get sick, though. It just means that they're less likely to get seriously ill and require hospitalization. But nonetheless, when a nurse gets sick, he or she needs to go home for their own safety and for the safety of our patients. The variant is just so contagious, it's sending more and more people home. And at a time when we need to be surging, barring really any outside help, we simply can't stay on this path and be able to operate. And that's the scariest part for those of us in healthcare, is that we don't believe that we're even in the worst phase of this surge yet. Now, Dr. Dunnigan is going to talk a little bit more about what we can do for New Year's celebration. So, Clay, go ahead.
Yeah, Alex, thank you. Dr. Garza has given you a lot to think about over the last 2 days, and we can give you more data, but sometimes it's important just to look around and see what's happening in your own circle of friends and family. I think all of us now know multiple people who've tested positive in the past few days, and it's one indication of how tremendously quickly this virus spreads and how much is out there in the community. That's the hallmark of the Omicron variant. It doesn't appear to necessarily be worse than Delta, but it spreads much more readily. And that's going to make the coming holiday time dangerous. I know many of you are planning to get together for New Year's celebrations with friends and family, and putting those gatherings together with such a contagious virus is a recipe for a lot more people to get sick, which means a lot more people needing hospitalization. And the challenge is right now, we are full to the gills with patients, including not just COVID patients, but people who have other vital healthcare needs. So this is not a great time to be taking risks with health that might put you in the hospital. But there are things you can do right now to help. And first and foremost, if you have not been vaccinated, you need to get vaccinated. If you have been vaccinated and you haven't gotten your booster shot, you should do so as soon as possible. Those things won't help right away. It will take a few weeks for them to have their full effect. But over the long pull, that's really what's going to help keep these surges at bay. And even in the present surge, as we'll talk about in a minute, most of the people being hospitalized, most of the people dying are unvaccinated. Those vaccinated individuals who wind up in the hospital typically are older or have some sort of disease that compromises their ability to combat COVID. So vaccination remains the most important single thing you can do. Shorter term, we want everyone to ring in the new year and move past a 2021 that many of us would like to forget. But given the current situation, we think you really should consider doing this in the smallest way you can. If you can limit the number of people in a gathering, please do so. And if you can gather only with other people who are fully vaccinated, that's the best choice. Doing those things will help us control the virus as we move into 2022. The highest risk of spreading, of course, is when large groups of people get together in a small space, not wearing masks, especially if they haven't been vaccinated. That's just physics and math. In those close quarters, there's a high degree of circulation of whatever people are breathing out, and it's very easy to acquire the disease. These situations really have to be minimized. So as you prepare, keep those thoughts in mind. Other things, first and foremost, if you are feeling sick, please do not go out. Even if you just think it's a little mild sniffle, stay home and isolate until you get a COVID test to tell you that it's not. There's so much virus in the community. People need to assume that any sort of respiratory illness is COVID or possibly the flu. And it would be much better to miss one New Year's party than to make a bunch of other people sick. If you are feeling well and can go out and you choose to get together with other people, there are some additional things you can do to mitigate risk. First of all, wear a good mask over your nose and mouth. We now have some reason to believe that cloth masks are probably not as good as against Omicron as they were against other variants. So finding more medical grade masks, N95s, KN95s, even surgical isolation masks that have better characteristics is a good idea. But any mask is still better than no mask as part of your defense against the virus. If you've chosen not to get vaccinated and or you don't want to wear a mask, please make sure the people that you are going to be with understand that. Gathering is only as safe as the most vulnerable person in that gathering. And you should think about that as you get together. We understand that people are making personal choices. And while we think getting vaccinated and wearing masks are prudent and responsible things to do, we know there are others who feel differently. But please don't let your choices affect others who don't have that chance to decide for you. Please let them know if you are not vaccinated and you are not intending to mask. These steps will help you, your family, and the people you don't even know to stay healthy. And they'll also help our healthcare workers, won't they, Alex?
Yes, absolutely. And speaking of those healthcare workers, throughout the pandemic, one thing that all of us hear is how grateful people are for those heroic efforts of our healthcare professionals and the support staff that have been really working for going on 3 years now to save lives. And I can tell you, and I think I would hear echoes from everyone who's worked in healthcare that they're really tired. And now they're asking for everybody's help to prevent this bad situation from getting any worse and more deadly. And I know that they would appreciate anything that you can do to help. Now, those healthcare staff and support staff, they've been through a lot. They've been through more than we could ever ask them to do. And while the majority of patients are really appreciative of those efforts, we've heard from our staff that there's been increasingly been some negative interactions because of different views regarding COVID. And while everybody can have their own opinion, one thing is certain, and that is healthcare workers and the support staff need to be treated with respect and with courtesy and be allowed to do their jobs. Now, they've been in this fight for, as I said, going on 3 years now, and they are experts in delivering care for COVID patients. So please give them this respect and let them do their jobs. Also, as we look ahead to the new year with kids going back to school, we want to reinforce the importance of wearing masks for kids and for teachers. Now, we encourage school districts to consider masking requirements, and we encourage parents to send their kids to school with masks. It's simply the safest and most effective way to keep our schools open and our kids safe. Now, Clay, I know that there's some other challenges that are out there with the healthcare systems, particularly in the ED.
Yeah, that's right, Alex. The last thing we need to mention is we really want to encourage people to stay away from emergency rooms unless they have an actual emergency. Please don't go to the emergency room just to get tested for COVID. You'll have an extremely long wait time. You'll be in an emergency room that is full of other people, and it's not an ideal situation. Testing is in short supply. There's no denying that. But there's still a lot of testing locations throughout the region, And because of the amount of virus that's circulating right now, we know it will be delayed, but we really don't want to have our EDs tied up with just answering the question of are you positive or not. So please help us keep the emergency rooms for emergency situations.
Yeah, and so just to summarize all of this, look, Dr. Dunnigan and I, we don't enjoy being the bearers of bad news. And we want everybody to be able to enjoy their friends and their families. But unfortunately, we're finding ourselves in a really challenging time right now. And we want everybody to be healthy and to be protected, which is why we're spending so much time talking about this deadly virus. So please, please, just do the right thing for yourself, for your family, for your school, for your community, and everybody have a very safe and a happy new year. And we will see you in 2022. Thank you.